For the past 20 years, MassEquality has been a leader in education and advocacy for rights of sexual orientation, gender identity, and gender expression. There have been many victories along the way, most notably for same-sex marriage, but currently there's more attention to the remaining gaps between legal equality and what people experience in everyday life. To tell us about that shift and efforts to hear more from local communities is the Executive Director of MassEquality, Tanya Neslusan. Thank you very much for being with us, Tanya.
Thank you, Chris.
Tanya, what about this moment we seem to be at? There's a lot of legal equality that might have been unimaginable 10 or 20 years ago, but what about this difference between what's in the law and what's in everyday life?
Well, I think with all of us, we see lived experiences are often very different than what's litigated. So, for instance, when you look at some of the legal protections around healthcare and accepting anyone you know into a clinic, it doesn't mean that when you get to that clinic, your gender identity or sexual orientation will be respected when you walk into that clinic. It doesn't mean that people are necessarily comfortable with your identity. It doesn't mean that it doesn't make it hard. And there's only so much you can legislate. A lot more of that, if we had the true understanding and education out there, we wouldn't need as many laws, quite frankly. And this isn't to discount the importance of legislative protections. It's still ultimately very important. But say, for instance, if you're looking at employment, yeah, it has been illegal in Massachusetts to terminate someone for their sexual orientation or gender identity for a very long time. The federal government just caught up with that last week with the passage of the Equality Act. However, it doesn't mean that you can't make someone feel uncomfortable in their job. And that's really what we're trying to get at, is trying to make sure that there's equity across the board in the way that people are treated and people can live their lives. We see a lot of disparities in the LGBTQ community in terms of health, especially with transgender healthcare, for instance, where people may not be able to get the type of treatment that they need.
Tanya, you have a background in technology and maybe overlapping with that health insurance. So what have you learned from that about these gaps in lived experience?
I mean, I think really what it comes down to is I was a data person when I worked in health insurance technology, and I had all kinds of information, and I truly took away from that having data is key. However, we don't always collect the data that we need, and you need to have that in order to make fixes. But beyond that, there's more than just a technical or a legislative quick fix. You really have to dig into the why is this happening and the how is this happening, because no person can be really reduced to a number. Everyone's experiences are different, and their lived experiences are different than anything you're going to see on paper. But ultimately, there are ways of approaching that data in order to try to ascertain what the greater good may be.
When we bring up the shorthand LGBTQ plus, that's a big tent for a lot of different kinds of people, different cultures, different races, and we see now more talk about divides, intersectionalities. How does the strategy that you're doing right now address those?
I mean, I think that's something that I am, personally very aware of in my daily life. When certain things happen to me, I do break it down. Is this because, I'm a woman? Is this because I am a gay woman? Is this because I am a woman of color? Is this because of who I am as a person? And really having to break that down. That being the case, I kind of try and look at everything through an intersectional lens. When we roll out programming, I try to make sure that as many voices as possible are included in the panels that we produce, and that we interact with different segments of the community as much as possible. Because LGBTQIA plus, that's a limited acronym. There are actually 26 letters in that acronym. And none of those letters address the intersecting identities of, race, for instance, or socioeconomic status, for instance. And those things play very heavily into that as well. So we really need to be deliberate, and I try to be very deliberate in my work, to try to make sure that we approach things so that they will have the greatest impact across the most people. And what I find is if you look at the majority of intersecting identities, and the hardest problems to solve, and you work on those, it trickles up and it benefits everyone.
What about some of the other divides? Because I'm thinking of things like access to care, especially let's say for mental health or even substance use problems.
Mhm.
If you're from the middle class, that's hard enough. But for people who are not, what about those needs?
Yeah, absolutely. Those are hugely important, and so that's one of those things where a lot of times when you look at healthcare disparities, you want to look at, okay, let's look at Medicare first and see what's going on in Medicare. And if you can get Medicare working, and get that to serve as a model for the private insurers, that's a good place to start, because you start at the most complex issues that impact the most amount of people. And, gradually it lifts the entire boat up.
Another issue that might affect a lot of people is sex education in high school. Maybe 20 or 30 years ago, it was controversial enough to have that as a way to prevent teen pregnancy. But now we're talking about the needs of the LGBTQ plus populations. And what about their needs?
Oh, absolutely. So one of the pieces of legislation that we are supporting, and we supported last session, is the Healthy Youth Act, which basically states in a nutshell that if you are going to provide sex education, that it needs to be comprehensive, science-based and evidence-based, and inclusive of LGBTQ identities. So, back in the day, when I took sex education years and years ago, it really was pregnancy based, but it was also STI related. And there is so much that kids need in order to protect themselves and protect their health and safety. It's important to cover all of that. And really, when it comes down to it, most parents are not necessarily aware that the information that they need to provide to their LGBTQ children. So there needs to be a reckoning, because the point of sex education is to provide information to protect these kids from pregnancy, but also from STIs and health risks, and also from a consent-based standpoint, to understand their limits and their boundaries, and how to safely engage with people so that they aren't put into a position without understanding what consent looks like.
To look at another population, the older people in the LGBTQ plus community, especially how they've been affected by COVID. What do you see there?
Well, we've had we did a COVID survey earlier in the year, in the beginning of the pandemic, and I also we did some outreach to LGBTQ elders. And really, what we were finding is that there were some disparities among the elders, especially around the isolation, mental health and depression issues, because this is truly, in some ways, the first generation that was publicly out. So a lot of them had made their families with their chosen families in different parts of the state, but didn't have the access to networks where, for instance, things like shopping, especially when we were going through grocery and disposable paper product shortages. There was a need for someone to just check on them, because of the isolation factor, and also medically, because a lot of LGBTQ elders are very hesitant when it comes to the medical establishment, and making regular appointments, and there is a distrust there in a lot of populations. So it really made it difficult, and still makes it difficult, to make sure that people are getting tested and being supported properly.
Finally, I know you're starting a process where you're basically listening to communities around the state to find out what they need and what they'd like to do. Is there some way that our viewers can find out about how to take part in that?
Sure, absolutely. We're actually kicking off our first 4 events in the first 3 will be held in March. On March 10th, we are kicking off the program in Northern Worcester County, followed by an event in the Berkshires on March 18th, and a 3rd event on the South Shore on March 24th, co-hosted with Quincy Pride. And we are going to be rolling them out in other communities throughout the state. We're going to have the registration information on our social media within the next week. And just keep your eyes peeled on our website for updates on other communities as they roll out.
Well, thank you very much for taking the time and joining us.
Thank you, Chris.
Tanya Neslusan from MassEquality.